Welcome to the show, everybody. Micah with CoronavirusDiaries, and today I'm fortunate enough to be able to speak with both Dr. Scarbrough and Marc Holley. This is an idea that we had based on a previous rally/protest that happened a few weeks ago, and I talked to both of them and asked them to come on and kind of have a group discussion. And it's based on mob mentality and groupthink. And before we jump too far into it, though, I want to ask each one of them just briefly, for anybody that's not familiar with who they are, what they do, to just give a quick brief on who are you and what do you do. So, Andy, Dr. Scarbrough, how about if you don't mind, please start.
Dr. Andrew Scarbrough, a clinical psychologist, licensed clinical psychologist practicing out of Twin Cities in Minnesota. I work with all different types of mental health issues and all different types of people from all different walks of life, and I like what I do.
All right, thank you. And Marc, please.
Sure. Thanks, Micah. Good to hear from you too, Dr. Scarbrough. My name is Marc Holley. I am the owner of Atlas Defense Violence Prevention Training Company, and in the shift that we've had since COVID started, business has still been moving on, but I've also taken on a role managing about a dozen screening sites throughout the Twin Cities at a medical device manufacturer. So about 50 people, and just a lot more hands-on time, socially distanced hands-on time
Yeah, right.
with our mitigation efforts in the Twin Cities as far as essential manufacturing goes.
Yeah, that's huge. That's something that we haven't actually talked about yet in our individual, is that you have transitioned to working. I mean, you sent me a picture. I was pretty surprised. You know, most security people you see don't have face shields and, you know, the whole get up on.
PPE.
But you're right in the mix. So thank you for that. So we'll just jump right into it. For the listeners and viewers, the reason that this came about was 2 weeks ago, just over 2 weeks ago, there was a rally/protest at the governor's mansion, just about a block and a half from my place. And under the circumstances, I'm putting myself in the position of guinea pig for this. So it's an opportunity, shouldn't be wasted, I think. But basically what had happened is I had interviewed a nurse who had been furloughed because of low numbers and not enough work in their hospital. They were in the pediatric department. It's obviously very different from an ER or maybe a respiratory department. But I was just kind of looking at it going, okay, that's a little weird. We're furloughing all these nurses, and it's hundreds. There was another nurse about a week and a half or so before that had also been furloughed in my network. So it was raising a lot of questions. On top of that, I had a family member that their business, they're in a different state, but their business had been shut down by the government, and then they were denied unemployment. So that might be getting worked out as we speak, but to date, they still haven't received any sort of assistance. And it got me pretty emotional to the point that when the rally was actually happening, I was on the phone with a family member and I went for a walk, and I was really frustrated with kind of being helpless, like not being able to, like they're not getting help. So I walk outside, I hear helicopters, horns honking, and I see at the time it was probably 300-400 people. It raised considerably. I think the police estimated roughly 800. I would wager probably more than 1,000 rotated through there at any given time or over the course of the few hours. But I saw 100 flags, American flags, and I saw a bunch of people wearing patriotic clothing, and I thought, yo, there's action happening here. Like Marc, before we started this call, he said, you know, you saw action. And that was it. I found myself in the middle of the mix. I found myself kind of reacting differently than I would have liked to, and specific to media and content, it's something that I've become very aware of, is that everything that I say and do when I'm presenting information, it really needs to be non-biased or to the best of my ability. And in that moment, I caught myself very just in a position that I hadn't anticipated being in, 30 minutes prior to that. So, Marc, how about for you opening it up? Just out of curiosity, this like mob mentality. In the past, you've worked with military, some pretty significant security operations in high threat environments, and you talked a little bit about maybe
riot
not
control.
necessarily, riot control. Would you dig into like kind of riot control and kind of maybe some elements of that you're accustomed to or had trained for?
Yeah, sure. And for a little bit more context, I was a military police officer and a shooting coach in the Marine Corps from 08 to 2016. So besides training other service members, we were also tasked with training foreign police in Afghanistan, South Africa, and some other places. And probably some of the things that stick out in my mind about riot control tends to be the fact that a lot of it, kind of like security, they're trying to be an active deterrent in their show of force, which is why they're geared up in catcher's gear. If you notice, a lot of like riot control gear is actually just repurposed baseball gear because either they don't have the budget or nobody's actually developed anything specifically for that. So yeah, a lot of it is show of force, and at the second protest too, we saw that quite a bit more. And there's actually a lot more that goes into the surveillance and preparation before protest that comes up, as far as open source monitoring, looking at the publicly posted pages that have the numbers and whatnot that claim who's going to be coming. They don't really base a lot of their preparation on those numbers necessarily, as far as like, when 1 million people say they're going to storm Area 51, we all knew it was going to be like 50 people, right?
Right.
So same thing goes there. They don't really take the actual like registration numbers as like exactly who's going to show up, but they still use that as a gauge to kind of decide how many streets need to be shut down, how big of a cordon, or how big of a what's the equivalent of cordon?
Secure area, like
secure area, or how big of a perimeter that they want to make. In this case, around the governor's mansion. So, like I said, there's lots of research. There's lots of active monitoring going on leading up to this kind of stuff. So, what I saw from like law enforcement just on the spot too is that they're very calm. They knew they had to be patient, and that's what like 90% of riot control is just waiting for the one or two bad actors that are there to cause property damage or instigate things. And we just didn't really see that, both at these protests and even at the Target Center protest at the last Trump rally too. There's a lot of people that thought there was going to be violence, but again, like I think most people really don't have a predisposition for that. It's just going to be those few people that really want to see what happens when they instigate things. So they have these things. It's called snatch teams, basically, where they're teams amongst the riot control lines that are trained to pick out the person that's instigating. I don't want to share too much. Maybe you can find this stuff on the internet. But
if it's open
they
source,
basically run out. They grab the guy. Yeah, it's open source. So it's a small team that's trained to be able to identify who's the instigator, go out there, grab the guy, and bring him back. And that's again like with more serious stuff too. And
sure.
I think that like the protesters, obviously, a lot of them want to. It's like a weird paradox where like they're worried about government overreach, but they're also backing the blue, but then they also don't want to be controlled by the police, and they don't want to see the police there to counter their efforts. So it was kind of a weird, paradoxical state that I kind of came across on last weekend.
Sure.
But yeah, I mean, they're all professional though, and the police, they do what they signed up to do, and it's kind of a risk of the job, of having to be around those kinds of people that willingly were spreading the virus. So all kudos to St. Paul Police Department. I lost count. I think I might have seen at least more than a dozen, 15 or so squad cars just on my walk up there. Yeah.
Yeah.
Well, hey, I got a question.
Yeah, and those guys, they're all getting called in. Yeah. Yeah.
I got a question for you. So, what would you say? Nobody likes to be told what to do, right? And I'm with you. I'm not trying. I play devil's advocate sometimes, so like I got nothing but respect for what you're doing. But to somebody who would say, "Hey, look at these military police out there, all decked out in their garb. They got riot gear on. What are you trying to do? Scare us all and make us think it's the apocalypse?" I've heard that argument. I like the show of force idea better personally, but what would you say to somebody who would say that?
I would say look for the totality of the circumstances, right? So at this protest, for example, all the police officers were in their standard uniforms. You didn't really have anybody geared up in all black. Last time I saw that was at Target Center, and that's because there's a lot more people. They had mounted patrols on horses. And even then, when things got a little bit sketchy, they really didn't do too much to the crowd. I don't think they even deployed tear gas at Target Center back in October. And there is people that were pulling guns on the crowd. So, like I said, like if that's your baseline, then the St. Paul protest at the governor's mansion was very calm. And again, that show of force was just their presence in their full uniforms. You could tell that they probably got some guidance on like looking professional and patient. So I would say if anybody is concerned or nervous about that realize too, like they're there to mitigate that bottom 5 or 10% that can make it worse.
Sure.
They're actually there to help everybody else fully exercise their First Amendment rights. You know, they're not doctors, so the cops aren't there to judge anybody for wearing a mask or not wearing a mask. The cops are just there to make sure that things don't escalate beyond control. So
it's interesting because the media would show you snapshots of the people looking the most, like they would probably find the show of force that would be the most, you know, dramatic, and they would snap shots of that, or like an armored vehicle coming in, and they'd say like riot at a governor's mansion, and they would show clips to like the worst possible stuff. But you're saying like the guys are out there in their casual gear. People are trying to be mindful of like keeping a sort of keeping a low presence, which would make sense. I mean, I think show of force is the smart path between those two. To the counterpoint, I think, you know, Micah, with your threat level response too, you know, with everything that was going on, you know, people's sympathetic nervous system kicks on, their anxiety starts going on, your adrenaline's up. That could take like an hour to dissipate too. And if people are in that state, they're capable of doing some higher reasoning skills, but they have to become very aware that they're in that state. I know both of you guys dealt with some tense situations, and you would certainly know that taking a moment to be like, all right, I'm kind of riled up, I'm jacked up, calm down, think about what I need to do, think about like logically work my way through this. With patients, what I would do is I would say, notice the signs, notice the specific behaviors that you're doing when you're jacked up. You know, does your face get red? Do you get
this,
like Mike?
It's happening right now. It always happens with me. Like part of it is that I live in a place where I don't control my own heat, so I have to close my windows.
I wasn't trying to pick on
but it's there, but it's real.
Yeah, but everybody does. I audibly growl if I'm upset. Sometimes I'm like, ah. Like I'll actually do that, and I don't try to do it to be funny. It's like a real dumb sort of thing. Everybody's got a few little things that they do. And I was talking to somebody, they were a deep water diver, and they're talking about, you know, when you go down into these caves and you're swimming around and you start panicking, you're kicking up dirt, you can't find your way out. If you're getting low on oxygen, you can die if you don't take that moment and say, okay, I could die, but I gotta calm down, I gotta relax. You need to let your sort of like higher order, your executive functioning, your frontal lobes take over and think through that. You know, it's amazing. Like you probably didn't have anybody around you, Michael, when you were jacked up in that situation, right?
I've been isolated for well over a month.
I guarantee you, if I were there, I remember we were trying to get connected to a UFC fight, and you were getting really jacked up because we were having some connection problems with our. It
was a big pay-per-view. It was a big pay-per-view. It was a lot of money was on the line.
and you were getting jacked up. You were getting mad, but I was there. I was like, dude, calm down. We'll figure this out. Like, relax. And you did kind of. You were kind of like, all right, I'm getting jacked up. Like, if left to your own devices, and you don't have somebody, or you're not trained to sort of catch yourself and say like, all right, okay, I'm doing that thing again. I'm cursing too much. I'm like, like pounding the table. My voice is getting that sort of pitch that I know that is not good. You know, husbands and wives will recognize this too. If it's like an eye roll or a subtle move, like a nonverbal cue, or you know what your problem is, like that kind of is like the warning to that. But
I thought you were talking to me. I was like, oh, he ain't going here, is he?
No. But yeah, like your threat response.
Well, out of curiosity. Oh, were you done or?
Yeah, I was done. Yeah.
Mark, with your previous training, whether it was with the like riot control stuff or maybe some of the stuff with the military, did you guys ever work with psychologists, or did they was there training that was developed around psychology?
I know that psychology was a factor in like the background of the training that we went through. Like I remember like probably like interpersonal communication, combat hunter, I'm trying to think. Those probably were the two top things that come to mind that may have been more involved in that kind of thing.
You said interpersonal communication and what?
And our combat hunter program, it's a program in the Marine Corps to help with situational awareness.
Okay.
And And yeah, that one too was pretty heavily influenced by psychologists within the military and whatnot. But like, as far as like direct FaceTime, I mean, sure, outside of what I tried at the VA, that was all for the aftermath stuff.
Right.
But outside of the VA, I don't think I've really had any. I don't think they really brought in like psychologists per se for the actual training part. They just told us it was developed, with the scientific approach.
Maybe
So
that's more for the
we
crime
just,
scene investigators or something.
yeah, they had us more like on the practical application side of it. And like Dr. Scarbrough was saying too, is sometimes it's just breath control. And I've got people that will contact me saying, like, Mark, what kind of gun do I need to buy for these anti-Asian attacks? And I'm like, practice deep breathing, bro. Like,
That's the number one skill that I like to people stick with that I teach. Like, and it's the simple. It's one. It's
yeah,
good point.
yeah, breath. The air is free, and
Yeah,
a gun's $700. So
Yeah.
with that $1,200 check, you got, think long before you go out
quick,
and buy stuff. Yeah.
absolutely. Quick note on anxiety management, deep breathing. If you want to get really good at it, what you're trying to do is focus a little bit more on your exhalation. If you think about when you're
Mm-hmm.
startled, how you gasp, you're taking in more air. When people are having a panic attack, they're hyperventilating. They're taking in more air than they need. So breathing in through your nose and really focus on a slow, smooth exhale, people are able to calm themselves down pretty dramatically.
Yeah.
That's interesting though, Mark. You talked about like interpersonal communication. Like I was talking to a parent today about the type of language they were using with their teenager, and like the phrasing, the subtle phrasing of certain things, and like, honey, if you could, would you please put the video game down when you get a chance, and maybe think about coming to the dinner table. It's like, that's not very forceful. You need to say like, you have 5 minutes to get to the dinner table, or if you don't, you're losing your game for the night. Like, that's pretty direct. And I was like, you need to make sure that the subtle verbiage of what you're saying is pretty direct. You don't want to be intimidating. You don't want to say, get your ass to the table before you don't know what happened and you're like, whatever. But there's a fine line. It's amazing how like a word or two here or there, or people's posture or their hands. I remember when I was taking some martial arts classes, they were talking about if you're in an attack situation, you'll put your hands up like this. It's a sign of kind of submission, but you're also ready to like grab or defend or strike. It's like there's a real smartness to how your nonverbal behavior is and the specific types of language that you use in those situations.
That's brilliant. I think it would be really interesting to hear from any psychologist. Or like, have you ever worked with any teams or anything, Dr. Scarbrough, where you're sharing this type of information?
I can think of, it's interesting. This is a cool meeting of the minds that I don't really typically interact with people like help me. I typically wouldn't interact with somebody like Mark and like talk about how I might be able to lend some thoughts to his job, but I think it could be better because I think psychology could offer more insight to that in some ways too. And a lot of professions, there's a lot of professions that could meet that might have some interesting sort of insights to share. I'm sure Mark's got some things that he could probably share with me and working with people who have who've been through situations and experiences that would inform me to be a better clinician. And
I mean,
go ahead.
Oh yeah, I was saying sometimes it's just really simple stuff too. Like there's so much research behind the deep breathing stuff that it just I think it just like flew under the radar for a long time because the information's always been accessible, at least in our modern times now. But Micah, I think I might have chatted with you over the winter about when I was doing the cold immersion therapy too. And same thing. I mean, a lot of that was just me trying to put into practice what I'm training my clients on too, and that's to help them have a little bit of presence of mind if and when a crisis situation does hit the fan. And my clients would hire me because they're worried about active shooters or workplace violence, and that's a credible risk. But more often than not, when we do a risk assessment, we notice that there's probably a higher likelihood for domestic disputes to spill over into the workplace, or former employees that feel like they've been shunned when maybe they feel like it's been an unjust firing. So there's been a lot of things, that I've noticed is backed in a lot of research that I likewise, Dr. Scarbrough could probably benefit from just learning more from you all too, because I know that like I'm on the application side of things, and I know that the approaches work, but sometimes I just enjoy reading and learning more about the background too. So we can articulate it better with just a wide variety of people they're working with. Even with my job now, that could probably help us a lot, because when we're screening for symptoms, it's you can kind of tell when people are about to lie on the screening question, and if they feel pressured to lie by management or other people. So it's a weird thing to kind of navigate where we're at right about now. But yeah, sometimes it is just having a little bit of empathy, and I think that at least helps people realize, like, if you get rid of that golden rule and stop treating people the way that you want to be treated, and just kind of put yourself in their shoes and figure out how they want to be treated, that conversation goes a lot more differently than me focusing on myself, thinking if I treat people the way I want to treat myself, then it's all on me, right? If I don't treat myself right, then I don't have to treat anybody else right. So
I was just talking with somebody about that today, about how using empathy would be an effective negotiation tactic with some of their coworkers. I can't reveal any confidential information, but they were a kind of a leader at their specific place, and they were having some issues. And I said, with this group of people you're trying to interact with, first validate what they're saying. They're concerned about it happened to be the COVID situation. And I said, validate their concern. Say, like, I get, you're concerned about, coming home and giving this to your children or your partner or whatever. Validate their concerns and then make your point, because you have a really good point. But if both people are just thinking about getting their point across and they don't think the other person has heard what they are saying, they're going to continue to do that. Your sympathetic nervous system is activated. You're going to continue to argue your point. It's kind of disarming when you say, like, with a warm tone, look, I get that you're stressed out. I get this is a tough situation. I appreciate all that you're doing here, but you might not even want to use the word but, because sometimes that sounds like it negates whatever the person said before. You say, I really appreciate everything that you've done. I think it's important for us to look at and then make your point. That's going to be a lot more successful than just continuing to yell your point while they continue to yell their point. Just getting really specific with the situation with this person today. And they were like, that's perfect. I think that would work, because nobody ever shows empathy. Everybody always kind of barks at each other, getting their point across. Nobody ever stops to validate the other person. And I
think you've got a bright future as a hostage negotiator, Dr. Scarbrough. So, well, thank you both. Did you?
That.
Go ahead.
Oh, I was just saying, and I've heard it framed like that too. Like, can you at least acknowledge the right of the other party to exist, right?
Yeah, even if you don't agree with it.
Yeah, at least acknowledge they have right to exist, and then at least there's some kind of starting point there. Yeah.
Is there some path, the way that I phrased it today, I said, is there some path where if you were in that person's position, you could kind of see where they're coming from? Because I like to believe too that if you were born in the same neighborhood with the same socioeconomic status, with the same family, with the same type of genetics, and you were exposed to everything exactly the same, and you were put in the same situation, you would likely behave very similarly or the exact same, based on those factors. And I think when you consider all of those factors and you try to imagine a scenario where you give somebody the benefit of the doubt, Carl Rogers, a famous psychologist, will call it unconditional positive regard. Expect that the other people doesn't have a malevolent intent. Expect that they want what they believe is good, even if you think it's misguided, but expect that they want the best from their point of view.
Yeah,
it's great sound advice. This was, I think overall, this was a great success. Really appreciate the two of you sharing your expertise and your knowledge. Really do wish we had more time, but Mark, I know you got that early wake up. Dr. Scarbrough, I know you've been at it all day long already. And I think this is great. Hopefully it'll get some sort of discussion going, and we'll see where it goes. But Did either of you have anything you want to share before we go?
I'm good.
I'm just, yeah, I can just share that Atlas Defense on social media has still been sharing up-to-date information on just, dry fire drills, stuff you can train on back at home. And the company I'm working for right now doing that screening, we're still hiring. So we're trying to find dependable people. They want to make $17.50 an hour. So my information will be, I'm sure, in the show notes but if you got listeners in the Twin Cities that are trying to find work, there's work to be had. And, it's a calculated risk. We have to make sure that we're, upfront with the nature of what we do. But it's a new necessary service that some security professionals are starting to realize that this is the new security. Like, if people want to be protected, they need to be protected from symptoms and the virus and whatnot too. So it's an interesting pivot that I've seen the security industry make, and that's why we're hiring right now.
And it'll be interesting to see where it goes here in the coming months and, maybe years. But great. Yeah. For all the viewers and listeners, all the information for Dr. Scarbrough and for Mark and Atlas Defense will be in the the section below. Feel free to reach out to them. I'm sure they'd be happy to hear from you guys. But until next time, Dr. Scarbrough, Mark, thank you both so much for being on the show. Really appreciate it. And for our viewers and listeners, stick around. We're going to have more of this kind of stuff coming your way. And until next time, just stay safe and keep doing what you're doing.
Stay healthy. Good to meet you, Dr. Scarbrough.
Yeah, likewise, Mark.